My name is Ishona Bowen. I'm currently a registered nurse working at the Cornwall Regional Hospital. Today's presentation, I'll be highlighting the role a nurse plays in a patient with diabetes. First and foremost, what is diabetes mellitus? Diabetes mellitus is a disorder in which the body does not produce enough or respond normally to insulin, causing blood glucose levels to be abnormally high. There are two types of diabetes. Firstly, type 1 diabetes, formerly called insulin-dependent diabetes or juvenile onset diabetes. In this type of diabetes, the body's immune system attacks the insulin-producing cells of the pancreas, and more than 90% of them are permanently destroyed. The pancreas therefore produces little or no insulin. Only about 5 to 10% of all people with diabetes have type 1 diabetes. Most people who have type 1 diabetes develop the disease before age 30, although it can develop later in their life. Type 2 diabetes. In type 2 diabetes, formerly called non-insulin dependent diabetes or adult onset diabetes, the pancreas often continues to produce insulin, sometimes even at a higher than normal levels, especially in the early phase of the disease. However, the body develops resistance to the effect of the insulin. So, there is not enough insulin to meet the body's needs. As type 2 diabetes progresses, the insulin producing ability of the pancreas decreases. So type 2 diabetes usually begins in people older than 30 years old. Gestational diabetes. In gestational diabetes, it is first seen in pregnant women who did not have diabetes at first before she was pregnant. In other words, blood sugar levels becomes high during pregnancy. Gestational diabetes usually shows up in the middle of pregnancy, around about between 24 and 28 weeks. Risk factors for type 1 diabetes. Family history. Your risk factor increases if a parent or sibling has type 1 diabetes. Environmental factors. Circumstances such as exposure to a viral illness might play some role in a person developing type 1 diabetes. The presence of damaging autoimmune body cells. So sometimes family members of people with type 1 diabetes are tested for the presence of diabetes autoantibodies. If you have these autoantibodies, you have an increased risk of developing type 1 diabetes. But not everyone has these autoantibodies develop diabetes. Risk factors associated to type 2 diabetes. Weight. The more fatty tissues you have, the more resistant your cells become to insulin. Inactivity. The less active you are, the greater your risk. Physical activity helps you control your weight. Using up glucose as energy and makes yourself more sensitive to insulin. Family history. Your risk increases if a parent or sibling has type 2 diabetes. Race or ethnicity. Although it is unclear why, certain people including Black, Hispanic, American Indians or Asian American people are at higher risk. Age. Your risk increases as you get older. This may be because you tend to exercise less, lose muscle mass, and gain weight as you age. So this is especially true if you haven't eaten in a while. It's best to eat some food when consuming alcohol. Consider the issue of consistency. If you have diabetes, you need to eat about the same amount every day and at about the same time. You shouldn't try to skip a meal or go more than 4 to 5 hours without eating during the day. Physical activity is an important part of managing your blood glucose level and staying healthy. Being active has many health benefits as it lowers blood glucose level, lowers blood pressure, improves blood flow, burns extra calories, so you can keep your weight down if needed. Improves your mood. It can prevent falls and improve memory in older adults, and it may help you sleep better. Exercise in appropriate amounts at least 3 times per week can also help people control their weight and improve blood glucose level. Because blood glucose level go down during exercise, people must be alert for symptoms of hypoglycemia. So some people need to eat or have a small snack before prolonged exercise, or even decrease their insulin dose, or do even both. Weight loss. Many people, especially those with type 2 diabetes, are overweight or obese. Some people with type 2 diabetes may be able to avoid or delay the need to take drugs by achieving and maintaining a healthy weight. Decreasing body weight by 5 to 10% through diet and exercise can significantly reduce the risk of developing future diabetes. Complications of diabetes. You have cardiovascular diseases, nerve damage, kidney damage, eye damage, foot damage, skin conditions, hearing impairment, or even Alzheimer's disease. How do we prevent these complications? Diabetes can cause poor circulation in the feet, making ulcers more likely to form when the skin is damaged and making the ulcer slow to heal. So foot care is very critical and very crucial. The feet should be protected from injury and the skin should be kept moist with a good moisturizer. Shoes should fit properly and not cause areas of irritation. Shoes should have appropriate cushioning to spread out and the pressure causing by standing. So our shoes shouldn't be uncomfortable any at all when we stand. We should not go barefoot at all times if you have diabetes mellitus. Regular care from a podiatrist, such as having your toenails cut and your calluses removed, may be also helpful. If you can afford one, you'll be gentle while doing it, so not so have to cut your skin, so you can take your time and cut your nails properly. Also, sensation and blood flow to the feet should be regularly evaluated by a doctor. Continually preventing these complications. So high blood glucose levels can damage the delicate vessels in the retina and affect the shape of our eyes, so temporarily causing like blurred vision. Hence, it's important to get an annual eye screen, wear sunglasses if the sun affects your eye, quit smoking, eat a healthy diet with fruits and vegetables and your good old omega fish oil. Now, what is the role of a nurse with a patient with diabetes mellitus? So as a nurse, it is important to discuss glucose monitoring at home with the patient according to individual parameters to identify and managing glucose variation. So all persons diagnosed with diabetes mellitus should have a glucose monitor at home to check the regular blood glucose levels. It's also important to review patients' common situations that contribute to the glucose instability, because there are multiple factors that can play a role at any time, like persons missing meals, infection, or illness. So in other words, as a nurse, it's important to question our patient and ask them what is really happening why your glucose is not being controlled. Encourage patients to read labels. The patient must choose foods described as having low glycemic index, high in fiber, and low in fat content. Educate patients on the function of his or her medication, because there are a combination of drugs that work in different ways with different blood glucose control and side effects. So as a nurse, it's also important to emphasize the importance of checking expiry dates of medication, inspecting insulin for cloudiness if it is normal, if it's normally clear, and monitoring proper storage and preparation, because these affect insulin absorbability. Review the type of insulin used. Note that type of insulin to be administered together with the method of delivery and the type of administration. Check injection sites periodically. So insulin absorption can vary day to day. In healthy sites, and is less absorbable in tissues. So it's important to administer insulin at different sites each time. So if you usually give it on your arms in the subcutaneous tissues, you can go to your abdomen. So please remember to rotate the sites. I hope you enjoyed this presentation. If you're a diabetic patient or if you're living with diabetes, it is nothing to be startled about, as many persons have been diagnosed with the condition. If you need more information, you can go to your regular health center, talk to your nurse there, and you can also research information for yourself. But be not afraid to have questions about your illness, as it's nothing to be afraid of. So take care of yourself, and please remember to maintain a healthy lifestyle. I thank you.